Hi, this is Dr. Matt Wiederholz at Performance Pain and Sports Medicine here in Houston, Texas. I'm sitting here with our good friend and patient, Mr. Morris. Mr. Morris was suffering from chronic back pain, continues to suffer from chronic back pain, and he was dependent on pain medication. And we had him on some very expensive pain medication that was costing him $400 or $500 a month out of pocket, and we decided we could do better. We ended up doing a trial of an injection of medication directly into his spine, and it relieved his pain tremendously well. So we ultimately implanted him with a targeted drug delivery device from Medtronic, which delivers medication directly into his spine. The advantages of that are that it's targeted delivery. It's sending the medication directly to the central nervous system to bind to the receptors, the pain receptors. And when you take a pill or you wear a patch, those medications aren't going directly into the spinal fluid. They're going through your system, they go into the blood, and then they have to cross the blood-brain barrier, which is a barrier that is not so easy to penetrate. And so a tiny bit of medication is actually getting to where it needs to go. Now, 100% of that medication is going where it needs to go, and the pump holds a fair amount of medication, and so we're seeing you, every 3 months or so?
Every 3 months.
Nice. And talk to us a little bit about the difference. Obviously, we know there was a huge financial difference in your particular case. Your out-of-pocket costs have gone down dramatically, which is fantastic. But what everyone really wants to know is it a more effective therapy? Is it relieving your pain better than what the medicines were doing?
It's relieving the pain at least as well and probably better, but I was very apprehensive about it at first. But I had all sorts of side effects with the other medication. It was constipation, there was nausea, there was night sweats, there was all sorts of things. Plus remembering when the last time I changed my patch. So this has become very convenient. I'm on Medicare, and all of us on Medicare understand the donut hole they talk about on the medicine, and it was going to cost me close to $10,000 a year to maintain the type of medication we were on. We tried this, and I am just as happy as can be.
That's fantastic. And I think that's one of the key things that you mentioned, the constipation, the other side effects that are associated with these medications. When we at Performance Pain and Sports Medicine use a pain pump, it's not like the pain pumps from 20, 30 years ago or even 5 years ago. We're using a strategy called microdosing, where we're using tiny dosages targeted specifically to a neural target, meaning a target in the spinal cord. And so we're using tiny dosages so you don't get those side effects. So in general, we're very pleased with the results of the pump. Better therapy, less side effects, certainly far fewer costs in your particular case.
Absolutely.
If you had it to do all over again, would you choose it again?
I would. I wish I knew about it earlier.
Fantastic.
I would have probably tried it earlier.
Nice. Happy for you.
Thank you.
All right, Dr. Matt Wiederholz here at Performance Pain and Sports Medicine in Houston, Texas. If you're suffering from chronic pain, come see us.